So how is diarrhea from immunotherapy different from diarrhea that patients experience with VEGF tyrosine kinase inhibitors? So patients with metastatic kidney cancer may have received prior therapy with the VEGF tyrosine kinase inhibitors, which include sunitinib, pazopanib, axitinib, or others. The diarrhea that patients experience with those therapies is very unique compared to that with immunotherapy. The oral VEGF TKIs have a short half-life, and diarrhea significantly improves and/or resolves with treatment interruption. In contrast, diarrhea observed with immunotherapy is more prolonged and may continue in spite of treatment interruption and the use of antidiarrheals being Lomotil, Imodium, or others. So it's important that healthcare practitioners understand that distinct difference and incorporate that into patient education. It's important to know what your baseline assessment of the patient's bowel function is. What is the frequency and the consistency of their bowel movement? Do they have trouble with constipation? That's always a possibility. But more importantly is to help educate the patients as to what is defined as diarrhea with immunotherapy. It can be 4 mushy bowel movements. It doesn't necessarily have to be liquidy bowel movements. But an increase in frequency and/or loss of consistency both really fit that potential category of immune-related diarrhea that needs to be evaluated and addressed. So important things to keep in mind at the initiation of treatment is to obtain a baseline assessment of the patient's bowel functions and help incorporate that into your patient education regarding changes from baseline. So an increase in frequency, worsening of the consistency or loosening of the consistency of bowel movements. What interventions have they done? Have they used over-the-counter Imodium or prescription Lomotil? And what impact has it had? If you're having them take an antidiarrheal and the diarrhea continues 24 hours later, you're going to want to reassess that. You're going to want, in kidney cancer patients in particular, to pay attention for the potential for dehydration with diarrhea, as patients may be already at risk or have chronic kidney disease. Baseline assessments and repeat assessments at the onset of diarrhea would include a blood count, a chemistry panel monitoring changes in BUN and creatinine. At the presentation with diarrhea in spite of treatment interruption of the immunotherapy, you'll want to get stool cultures, stool for C. diff, and make sure that there isn't another reason for which the patient has diarrhea. You'll want to track the use of the antidiarrheals and what impact has that had on it. Clinic assessment then would include that discussion. Are they having abdominal pain, cramping, mucus with the bowel movements? It may be appropriate for CAT scan of the abdomen and/or colonoscopy. Treatment for immune-related diarrhea includes the use of oral steroids. Prednisone 1 to 2 milligrams per kilogram initiated when diarrhea is refractory to the oral antidiarrheal agents. It's important that you follow up and reassess 24 hours later, what is the impact of the steroid? Is it settling down? Is it improving the diarrhea? Patients who have continued diarrhea in spite of oral steroids may actually not be fully absorbing those steroids. It's appropriate to bring that patient in for IV fluids and IV steroids, possibly daily as an outpatient for several days. As long as that's improving, then convert them to oral steroids. In situations where they're still having frequent dehydration and diarrhea, it's most important to admit that patient. That patient then would be appropriate for a gastroenterology consult, further evaluation by CT imaging or colonoscopy, continuing the IV steroids and dietary management, and it may be indicated for refractory diarrhea from immunotherapy to use infliximab. And that has been very beneficial in helping to manage the diarrhea. So those are several options that are available, or stepwise progressions for managing diarrhea related to immunotherapy. But again, it's most important that patients are aware of what the distinct differences are, as well as the healthcare practitioners, between immune therapy-related diarrhea and VEGF-TKI diarrhea. It's also important to be aware of the potential for chronic kidney disease and the benefits to a gastroenterology consult. So education, awareness, and close monitoring will help manage immune-related diarrhea.